our next presenter is Katrina Boldt. Katrina is currently employed as a clinical nurse specialist at the Pilbara Public Health Unit and covers the Regional Immunisation Coordinator role. Katrina has worked across multiple WACS regions during her career as a nurse in emergency departments and community health. It is during this time she has developed an interest in public health, rural and remote health, and Aboriginal health. Thank you. Presenters notes. Oh, sorry. Good morning, everyone. You get me just before lunch, so hopefully you can hold out before you get your snacks. As said, my name's Katrina. I'm one of the public health nurses and the Regional Immunisation Coordinator in the Pilbara. And I wanted to talk to you all today about the Health Hub, which you might have heard previously, but this is looking at more specifically vaccinations that were delivered here and how the Health Hub was able to meet the needs of immunisations for the community within a community setting. So just firstly wanted to acknowledge the traditional owners of the land. Sorry. Yeah. Firstly, I just want to respectfully acknowledge the traditional owners of the land where the Health Hub is situated, which is in Nulama country. And I do repay my respect to their elders past, present and emerging. So the Health Hub, a bit of background, it first opened in mid-2019 in May, and it was opened by the West Pilbara Population Health Team, and they opened, it's in Karratha basically. This was in partnership with the Western Australian Centre for Rural Health, who was leasing the space and were kind enough to let us share it. It's located in Karratha Shopping Centre, which is right next door to a pharmacy, which is great if parents, for example, that aren't eligible for vaccines can pop next door. Supermarkets, so Coles and Woolies are nearby, Kmart's nearby, and also just other outlets. So it's a space where most of the town actually go through. So it was open on Thursdays, which was chosen because of late night shopping, even though we weren't able to stay open late. So we'll open from 11 a.m. to 5 p.m, which allowed clients, especially families, to access, and particularly after school. So most schools finish at 2:30 up in the Pilbara because it's hot. And so that gave parents some time to come in for those vaccines. In addition to immunisations, just to make a point, Health Hub also provided free sexual health screens to the community and was also just another easy access point for RHD clients to come in for their monthly treatment too. It was usually staffed by at least 2 nurses and an Aboriginal health worker, a little bit more when we had staff, but we all know how hard that is. And as mentioned, it was open every Thursday for the time that it started, except for some disruption due to COVID where we'd have to close for a couple of months at a time because of restrictions. So just for those that are not WACS, population health, for every immunisation encounter, we record in the Community Health Information System, or CHIS. The clinical item that we use for all immunisations is a checklist and consent. So that's used for every single immunisation encounter. And so a report was pulled from CHIS for this clinical item so that we could analyse occasions of service. So a report was also used for all immunisations given at Health Hub during this time, and it was this report actually breaks it down by individual vaccines. So, for example, we'll have Infanrix Hexa and Vaxigripp Tetra, so you can actually see which vaccines have been given. In CHIS, clinicians select an encounter place. For example, it might be Karratha Health Campus or Headland Health Campus, which is predefined. So unfortunately, Health Hub opened in May 2019, but we didn't have that encounter place until the 31st of January 2020, hence why I pulled the report basically from 31st of January, otherwise we weren't completely sure that they had not had it at Karratha Health Campus and had it at Health Hub. So of note, encounter places must be manually selected by clinicians. So they'll usually do it when they open a patient's notes, or they'll do it before they open a patient's notes. Therefore, there's always that risk that they've forgotten to change the location, and vaccines reported maybe weren't given at Health Hub and were instead given at Karratha Health Campus, and they just hadn't changed the encounter place. But that's also vice versa as well, so that could go either way. However, the encounters were reviewed manually to ensure that data was as clean as possible. So when reviewing the vaccines given, it was also noted if an influenza vaccine was given at the same time. If only an influenza vaccine was given, it was indicated as part of the influenza schedule. If the influenza vaccine wasn't available due to the time of year, so we ended up kind of doing between that February and April period when it wouldn't be available, it was documented as not available, and also if a child was less than 6 months, that was also indicated too. For children attending for specific childhood scheduled vaccines, such as a 12-month schedule, timeliness was also recorded. And fortunately, with our last presenter, Sarah, it was similar that we used for that. So this was determined by the date the vaccine was given minus the due date for the scheduled vaccine, which was calculated by the child's date of birth. Timeliness wasn't calculated for catch-up vaccines, including overseas catch-up, just because it becomes more complicated, and particularly overseas because it's just all over the place sometimes what we're having to provide. The overdue variable was then determined by timeliness. So overdue was indicated if a child received their scheduled vaccine more than 30 days after it was due. This was chosen because of the Australian Immunisation Register's overdue rules for what constitutes overdue, as well as the literature seems to sit around that time as well. So this was only a descriptive analysis and didn't compare other services such as immunisation clinics at Karratha Health Campus to see if we were seeing different clients at the Health Hub. So basically our results, a total of 2,078 vaccine encounters occurred during this time frame, so from the 31st of January until the 31st of August this year. Over 1/4 of clients identified as Aboriginal. The age of clients receiving vaccines was between 6 weeks of age and 77 years of age, with the median age of 4 years. The majority of the vaccines that were given were to clients under 5 years of age. And a total of 3,790 vaccines were given during this time, with almost a third being influenza vaccines. So of those vaccine encounters, clients attending for childhood schedules or just an influenza vaccine only were the vast majority of the encounters. However, we did see clients for antenatal vaccines were also quite common, school immunisations, catch-up vaccines, including overseas, as well as other adult vaccines too. So of the 1,874 vaccine encounters where an influenza vaccine was available and the client was over 6 months of age, or 6 months and older, 2/3 of clients received an influenza vaccine. However, this analysis didn't determine if the client had already received a vaccine elsewhere or if they were actually eligible for NIP funding as well. So that's just obviously a bit of a limitation. Out of the 145 antenatal presentations where a vaccine was available, so not between February and April, the majority received an influenza vaccine along with their DTPA. Of the children receiving catch-up, that was not an overseas catch-up. Over a third required vaccines from 2 schedules. For example, they needed their 6-month vaccines and 12-month vaccines. So seeing a fair bit of children that are quite overdue. As you can see, there were times where vaccine demand was higher than usual. So that big pointy blue line is 2020. So this was due to the increased demand for influenza vaccines. So this was obviously when there was a lot of promotion by WA during the initial time of COVID. But also from memory, there was also unfortunately a fatality in a child for influenza too. So that actually created more demand. And interestingly, even though we're not looking at 2019, there was a really peak in demand too when we had our meningococcal outbreak. So Health Hub was yet another place where those eligible for that meningococcal response could come and get their vaccine. Periods where there were no encounters at all was when Health Hub was closed. So this was between March and April in 2020 and March and July in 2022 because of COVID restrictions. So over time, there has been some changes in what vaccines clients are presenting for. So whilst in 2020, obviously with that big demand for influenza vaccines, over time childhood vaccines have taken over influenza vaccine presentations. So Health Hub's become more of a place known for clients to come to get their kids vaccinated. Interestingly, there's also been a decline in pregnant women attending for antenatal vaccines. Not sure of the reason for this. Potentially they're getting more done by the midwives. Potentially they're just wearing the population health's in the hospital near antenatal, so maybe they're coming straight to us there, or maybe they're just not getting them. So regarding timeliness, of the 833 clients seen for childhood vaccines, more than 50% were delayed in receiving their scheduled vaccines. Of the 457 clients who were overdue for childhood vaccines, the delay ranged from 1 to 910 days overdue for that scheduled vaccine. So some of those kids nearly 3 years overdue. Half of these children were seen within 3 months of becoming due. So the majority of them is kind of seen within 4 months of being due. The proportion of children who were overdue vaccines by more than 30 days changed over time, with a large decrease in 2023. This could be multiple reasons, ever the optimist. This could be due to an increase in timeliness within Karratha, or it could be a broader reduction in children presenting for vaccines at all, but I'll be hopeful. So there are a number of findings of this simple analysis. The majority of clients are presenting for influenza and childhood vaccines. Most presentations for childhood vaccines were in children that were overdue. So that kind of shows that it's a good access point for families that maybe aren't getting there on time. And it really shows that Health Hub is an accessible service for children requiring catch-ups, particularly being in the shopping centre, but also including overseas catch-up. A lot of our overseas catch-ups are for school-aged children, so they can come in after school, school immunisations, as well as adults presenting for other vaccines other than influenza. So there are some limitations, including that there is no further information if clients didn't receive the influenza vaccine. Was it because if they were even actually eligible, or if they may have received it already elsewhere. Also, there's no comparison with other Karratha community health services to determine if clients seen differs to that service. So are we seeing different clients in Health Hub compared to the ones that we're seeing in the hospital? So what next? Unfortunately, it's with a heavy heart that Karratha Health Hub had to close its doors on the 5th of October 2023. Just because now, so the space is now being utilised by the local Aboriginal Medical Service. We've tried to kind of see if maybe we could come in a couple of days a week, but not at the moment. But hopefully they can continue to have a really accessible service for Aboriginal clients. But also we are looking for another space because obviously we also need to provide vaccines to our non-Aboriginal clients too. And not all of our Aboriginal clients do go to the AMS as well. So we want to make it as accessible as possible. So still looking around, talking to the Shire to see where we can maybe go in. But unfortunately, Karratha is an expensive property market. So just a final thank you. So to all the hardworking community health nurses, school health nurses and child health nurses that worked nearly every Thursday over 4 years down at Health Hub providing the vaccines. And a big shout out to Aboriginal health workers that would call up families, get them to come down to the shopping centre. If it was a bit quiet, they'd scout the shopping centre because they knew who was who and bring them in. Also to the WA Centre for Rural Health to providing the space for us as well, but mostly to all the clients and families who attended the Health Hub, because we found that lots of families came back time and time again for those vaccines. So that's it. Thank you. Yes. Sorry.
Any questions for Katrina?
Hi, Rachel from CDCD. This is a question about your co-administration of NIP and influenza vaccines. Did those that were co-administered, were they mostly prompted by the provider that's why they received both, or did most patients come in asking for both?
Yeah, so most of it is like our staff being community health nurses, just ask everybody that are eligible for influenza vaccines. So even though I didn't look at that specifically, I would imagine most of it is that it's just offered at the time. So whereas you definitely had kids that came in just for influenza vaccine as well, where you'd get whole families come in too. So yeah.
And if you found that they were overdue for their nip vaccines, would you then also ask if they would like?
Oh yeah, definitely. Yep, definitely. And I guess that's the thing, is that that's the school health nurses, child health and community nurses' core business. So they're very good at doing that. Yeah.
Thanks, Katrina. That's fabulous. It's such a shame you had to close it. So hopefully that gets sorted out. I just had a question about your clinic flow. So I'm assuming it's a drop-in unbooked clinic. And if you have very overdue kids or overseas vaccinated kids and it's busy, how do you sort of handle getting the catch-up plan done and getting that all flowing through?
Yeah, so I mean, definitely makes it hard, and that's where having 2 or 3 nurses and Aboriginal health worker helps, because you all kind of work together. With overseas, usually they've come in because they've been prompted by us. So usually a nurse or 2 have already worked out a catch-up plan, which makes it easier. That's been documented in the notes. So then whoever's seeing them can just double check that before they give it to see that they're happy. With our Aboriginal clients, as a general rule, they're so overdue already. So we would just, sometimes you might kind of say, do you want to go like walk around and come back in 5-10 minutes or something, and we'll make sure that this is all correct. But most families were just happy to wait until that they'd done the overdue as well. So yeah.
Thanks, Katrina. I was just wondering, obviously you were talking about the immunisation, but with the STI checks and RHD, was that also a successful service for that?
Yeah, I don't have the data on it. I think in its initial stages it was promoted more. So I think it was more successful earlier on in it opening. So there is definitely information around that. But our research and evaluation coordinator recently kind of did a bit of a 3-year evaluation on it. And definitely STI screens decreased over that time while vaccinations really increased. So, yep.
Thanks.
I'll just add too, we have a drop-in clinic at Karratha Health Campus for STIs too. So I guess people can still just drop in for that. And most of them are more aware of that, I think, than Health Hub.
Thank you. Sorry, as a possible silly question, what is RHD?
Oh, rheumatic heart disease.
Lovely.
Sorry.
No, thank you very much.
We might leave it there. Thank you so much, Katrina.